In this video, you will learn when regular onions can pose a serious threat to your health. Although onions are often considered a natural way to support the body, in some cases, they can actually cause harm and even lead to life-threatening consequences. We will go over 10 situations in which it is necessary to stop consuming onions immediately in order to protect your well-being and avoid a critical mistake. This video is going to be incredibly informative and helpful. If you want to take control of your health like a pro, give it a like, and let's get started. 1. Stop eating onions immediately if you have blood circulation disorders. Onions are traditionally viewed as a healthy food because of their natural ability to reduce the risk of blood clot formation. However, this property can become a serious threat for people with blood clotting disorders. The issue lies in the high concentration of sulfur-containing compounds found in onions, substances that actively prevent platelets from clumping together. Under normal conditions, this helps lower the risk of thrombosis. But for individuals who already have impaired clotting, these effects can lead to dangerous blood loss. Regular onion consumption can reduce platelet aggregation by 30 to 50%, which means that if a person starts bleeding from the nose, the gums, or even from a minor injury, it may become much harder to stop. The risk is especially high for those taking anticoagulant medications such as warfarin or clopidogrel. These drugs already suppress blood clotting on their own, and when combined with onions, their effects can become uncontrollably amplified. In real life, this may result in spontaneous bleeding, persistent bruising, heavy bleeding from minor cuts, or even after brushing teeth. In the case of serious injuries, such a condition could require emergency medical attention, blood transfusions, and a long recovery period. That is why if you have blood clotting disorders or take blood thinning medications regularly, you should either completely avoid onions or strictly limit their intake, but only after consulting with your physician. 2. Stop eating onions immediately if you have a stomach ulcer or gastritis. Onions are among the most aggressive foods for the lining of the stomach. They contain essential oils and sharp sulfur compounds that stimulate the secretion of gastric juice and irritate the walls of the stomach. In a healthy person, this might go unnoticed, but for those suffering from gastritis or a stomach ulcer, onions become a real trigger for flare-ups. With peptic ulcer disease, any additional stimulation of gastric juice secretion leads to increased inflammation, irritation of erosions, and worsening of ulcerative defects. As a result, pain in the upper abdomen intensifies, and symptoms such as heartburn, nausea, a burning sensation, and heaviness after eating appear. According to medical data, about 40% of patients with ulcers report a worsening of their condition after just a single serving of raw onion. If consumption continues regularly, it can provoke dangerous complications such as gastric bleeding. A person may not immediately realize that onions are the cause of their worsening condition, as onions are a familiar and common food at the table. Raw onions are especially dangerous, whereas thermally processed onions, such as boiled or stewed, have a less aggressive effect. However, during the acute phase of the disease, even these forms should be completely excluded until the stomach lining has fully healed and a consultation with a gastroenterologist has taken place. 3. Stop eating onions immediately if you have liver diseases. The liver is the main detoxification organ that processes all substances entering the body, including the active components of food. When onions are consumed, bile production is activated because the compounds in onions stimulate liver cells, known as hepatocytes, to work more intensively. For a healthy body, such stimulation is beneficial as it helps digest fats and supports metabolism. However, in the case of liver diseases, such as chronic hepatitis, cirrhosis, or fatty liver disease, the situation changes dramatically. A damaged or inflamed liver struggles to cope with additional stress. The increased production of bile and the processing of the active compounds found in onions demand more resources from the weakened organ, which can accelerate the destruction of hepatocytes and the progression of the disease. According to American studies, 28% of patients with chronic liver diseases experienced elevated levels of liver enzymes, specifically alanine aminotransferase, ALT, and aspartate aminotransferase, AST, in the blood due to regular onion consumption. These enzymes are markers of liver cell damage. In real life, this manifests as an increased feeling of heaviness in the right upper abdomen, heightened fatigue, worsening of general well-being, and changes in biochemical blood tests. If these changes are not detected in time, progressive inflammation of the liver develops, eventually leading to irreversible processes of fibrosis and cirrhosis. Therefore, patients with liver diseases are advised to completely avoid or severely limit the consumption of onions, especially in raw form. 4. Stop eating onions immediately if you have heart failure or severe heart diseases. Onions are often seen as a heart-friendly food because of their antioxidants and their ability to lower cholesterol levels. However, when it comes to people with heart failure or serious cardiovascular diseases, the situation is quite different. The sulfur-containing compounds in onions, including allyl sulfides and other active components, have the ability to dilate blood vessels and lower blood pressure. Under normal health conditions, this can actually be beneficial. But in a person with a weakened heart, the dilation of blood vessels can lead to a sharp drop in blood pressure and disrupt hemodynamics, the heart's ability to pump blood effectively. When vascular resistance decreases, while the blood volume remains the same, the heart must work harder to maintain circulation. For patients with heart failure, this additional strain can worsen symptoms, such as swelling in the legs, rapid heartbeat, difficulty breathing, and increased fatigue. According to observational data, 26% of patients with severe chronic heart failure experienced a worsening of symptoms just 1 to 2 hours after consuming raw onions. These symptoms included increased shortness of breath, dizziness, weakness, and unstable blood pressure. Onions are particularly dangerous for those who take medications that regulate heart rhythm or lower blood pressure. Onions can amplify the effects of these medications, leading to hypotension or arrhythmias. In cases of unstable heart conditions, even a single serving of a dish with a large amount of onions can cause serious deterioration, especially in elderly individuals. This is why doctors recommend that patients with chronic cardiovascular diseases, especially those with chronic heart failure and coronary artery disease, limit or completely eliminate raw and spicy onions from their diets. 5. Stop eating onions immediately if you have a severe form of irritable bowel syndrome, IBS. Irritable bowel syndrome, IBS, is a chronic functional disorder in which the intestines do not work properly without any visible cause. Patients suffer from constant or periodic abdominal pain, bloating, and irregular bowel movements. The causes of IBS are complex, but certain foods can significantly worsen the symptoms, and one of the main such foods is onions. Onions contain fructans, which are a special type of short-chain carbohydrates that are poorly digested in the small intestine. As a result, they quickly reach the large intestine, where they serve as food for bacteria. The fermentation of fructans is accompanied by the active release of gases, leading to bloating, cramping, and irregular bowel movements. For someone with IBS, this becomes a real challenge. Even just a few slices of raw onion can cause a sudden onset of pain, gurgling sounds, diarrhea, or conversely, painful constipation. Medical studies show that 70% of patients diagnosed with IBS experience worsened symptoms within the first few hours after consuming onions. Raw onions in salads, sandwiches, or marinades are particularly aggressive. Cooked onions, such as boiled or stewed, may be slightly less irritating, but they should also be avoided during periods of flare-ups. It is important to understand that even hidden forms of onions, such as in soups, gravies, or sautés, can trigger unwanted reactions. For patients with IBS, diet is a key element in managing symptoms. Excluding onions and other FODMAP foods, those high in fermentable carbohydrates, can greatly improve quality of life and reduce the frequency of flare-ups. 6. Stop eating onions immediately during a hemorrhoid flare-up. Hemorrhoids are a condition in which the veins in the rectal and anal area become inflamed, enlarged, and painful. During a flare-up, it is important not only to maintain hygiene and rest, but also to carefully monitor the diet, as certain foods can sharply worsen the condition. One such food is onions. Onions have the ability to increase blood flow to the pelvic organs. This is due to their vasodilating and stimulating properties. When spicy or raw onions are consumed, blood flow to the hemorrhoidal nodes increases, leading to swelling, additional inflammation, and increased pain. For a person already suffering from acute or bleeding hemorrhoids, this effect can become a serious issue. intensifying pain, causing a burning sensation, itching, and more frequent episodes of bleeding during bowel movements. Medical statistics confirm that 45% of patients with acute hemorrhoids report a worsening of symptoms after consuming dishes containing onions. The combination of onions with other irritating foods, such as spicy seasonings, fried meats, and alcohol, is especially dangerous. In some cases, excessive irritation and increased blood supply in the anorectal area can lead to thrombosis of the hemorrhoidal node or the need for urgent surgical intervention. That is why, during a hemorrhoid flare-up, doctors strongly recommend completely excluding onions from the diet in any form, whether raw, fried, baked, or pickled, and only returning to onion consumption after the inflammation has fully subsided and with approval from a physician. 7. Stop eating onions immediately when preparing for surgery and during the early postoperative period. When a person is preparing for surgery, doctors always pay attention not only to test results, but also to the patient's diet. At first glance, regular onions may not seem concerning, but they can actually cause complications if consumed in the preoperative period. Onions have pronounced blood-thinning properties due to the presence of sulfur compounds, which reduce the ability of platelets to form clots. This effect is similar to the action of small doses of aspirin. During surgical procedures, it is especially important for blood to clot quickly and efficiently, as this helps reduce blood loss and speeds up recovery. However, if a patient consumes a lot of onions before surgery, especially raw onions, it can significantly increase the risk of bleeding during the operation. American surgeons recommend excluding from the diet any foods that can affect blood clotting at least 5 to 7 days before surgery. Ignoring this recommendation can result in uncontrollable bleeding during the procedure, increased blood loss, a higher risk of hematoma formation, and longer recovery times. After surgery, especially if there are stitches or implants in the body, any additional blood thinning remains dangerous, as it can provoke internal bleeding and slow down tissue healing. Thus, even a common food like onions requires caution during the preoperative and early postoperative days. It is best to completely eliminate onions from the diet 1 week before surgery and only reintroduce them after getting approval from the treating surgeon. 8. Stop eating onions immediately if you have gallstones. Onions actively stimulate the function of the liver and gallbladder. They increase bile production, improve digestion, and enhance the contractions of the gallbladder walls. For a healthy person, this is an advantage. But if there are already stones in the gallbladder, especially medium or large ones, eating onions can become a dangerous trigger. When the gallbladder starts contracting actively under the influence of onions, the stones inside it begin to move. One of them can get stuck in the bile duct, causing an acute gallstone colic attack. This condition is accompanied by severe pain in the right upper abdomen, nausea, vomiting, and sometimes a rise in body temperature. The pain can radiate to the back or right shoulder, and no position of the body brings relief. According to clinical observations, in patients with stones larger than 5 millimeters, the probability of an attack after eating onions increases by 35%. This risk is especially high after consuming dishes with fried onions or spicy marinades, where the concentration of active substances is the greatest. With repeated irritation of the gallbladder, the risk of developing cholecystitis, inflammation of the gallbladder wall, increases, which may then require medication or surgical treatment. Therefore, if gallstones are present, even if they have not yet caused symptoms, doctors recommend eliminating foods that stimulate bile secretion from the diet, including onions. 9. Stop eating onions immediately if you have an advanced stage of kidney failure. The kidneys are the body's main filtration system, responsible for regulating electrolyte balance and removing excess substances, including potassium. However, in cases of chronic kidney failure, CKD, especially at a stage when the glomerular filtration rate, GFR, falls below 30 milliliters per minute, the kidneys can no longer effectively eliminate excess potassium from the body. This is dangerous because potassium affects the functioning of the heart and muscles. Its accumulation can lead to hyperkalemia, a condition where there is too much potassium in the blood, causing arrhythmias, weakness, and in severe cases, cardiac arrest. Onions, despite their nutritional benefits, contain a relatively high amount of potassium. This is especially true for boiled and stewed onions, which are often consumed in large quantities as a side dish or in soups. Even though the potassium content in onions may not seem very high, when kidney filtration is impaired, its impact on the body's potassium balance becomes significant. Regular consumption of onions in cases of CKD can lead to potassium buildup and worsening of the disease symptoms. Therefore, individuals undergoing dialysis, as well as those diagnosed with stage 4 or stage 5 chronic kidney disease, are prescribed a special low-potassium diet by doctors and dietitians. This diet either excludes onions entirely or allows only minimal amounts of thermally processed onions, and always under the control of biochemical blood tests. 10. Stop eating onions immediately if you are taking certain medications. Onions are not just a food, they are also an active biochemical component capable of interacting with medications. Their effects on the liver, intestines, and circulatory system can either enhance or weaken the actions of many drugs, which is especially dangerous for people with chronic illnesses. This primarily concerns medications used for blood thinning, lowering blood pressure, controlling blood sugar levels, and treating cardiovascular disorders. If you are taking anticoagulants such as warfarin, aspirin, or direct thrombin inhibitors, consuming onions can amplify their effects. This increases the risk of internal and external bleeding, the appearance of bruises, bleeding gums, and nosebleeds. Onions can also intensify the effects of antihypertensive medications, causing sharp drops in blood pressure. This may lead to dizziness, loss of balance, and fainting. In patients with diabetes, onions can lower blood sugar levels, especially if they are taking insulin or medications like metformin. This can result in hypoglycemia, a dangerous condition where blood glucose levels fall too low, causing weakness, trembling, sweating, and confusion. Additionally, onions can interfere with the metabolism of medications in the liver by either blocking or enhancing the activity of enzymes responsible for breaking down these drugs. This can lead to an accumulation of the medication in the body, or conversely, reduce its concentration below therapeutic levels. Therefore, if you are taking medications regularly, especially for chronic conditions, adding onions to your diet requires mandatory consultation with your physician or pharmacist. Only a specialist can assess potential risks and provide clear recommendations on whether such dietary additions are safe in your case. Next, I recommend checking out these videos, and don't forget to leave your likes and comments. I'm looking forward to them.